Hello guys, welcome to this OTAD session. So we are doing a series of investigations. So this set of questions was about specular microscopy. So I have given you 5 questions with images therein. So I hope you've answered the questions, you found the questions useful. Now where to find the questions? The questions are in the form of a PDF. I've uploaded it on my Scribd account, Dr.Rajarathna. So you can download it there to have a what can I say, like a collection of your questions. So it's all there, and I regularly post it on my Facebook group and the various channels. So let's go ahead and start discussing the various questions on specular microscopy. All right. The first question was corneal endothelium may be visualized by. Now, what are the options that are given to you? Slit lamp, specular microscopy, option C, confocal microscopy, and D, all of the above. Now, all of you know that specular microscopy is definitely used to visualize corneal endothelium. Now, what you do not probably know is that you can see the endothelium even on slit lamp if you adjust the viewing settings in such a way, what we call as, when you have you can see the specular reflections. So you adjust the observation arm and the light in such a way that the angle of incidence is equal to the angle of reflection, right? So in slit lamp we use this Snell's law. Yes, you know, right? So we make use of this principle. We can see the endothelium. The specular microscopy definitely and confocal microscopy, in fact you can use it to see all the layers of the cornea. So obviously you can see the corneal endothelium as well. In fact, when you have a corneal edema, you will not be able to use specular microscopy to visualize the endothelium. So in such cases, confocal microscopy is an added advantage because you can see even through an edematous cornea. So the actual answer is all of the above. I hope you learned something through this question number 1. Now, second question. Which of the following may be measured using specular microscopy? Okay, now hexagonality, CV, what is CV, endothelial cell density, all of the above. Now, all of you know that endothelial cell density can be measured by specular microscopy. What you probably do not know is that even hexagonality and the coefficient of variation can also be measured on specular microscopy. All right. So the answer is again all of the above. Now, what is hexagonality and what is coefficient of variation? I'll be telling you so that if they ask you anything more, you should be able to answer. Now, what is hexagonality? You all know that the shape of the endothelial cell is hexagonal. Each endothelial cell is hexagonal in shape. So we're going to see what is the percentage of cells that are hexagonal. So that is what we mean by hexagonality. Okay, so the percentage of hexagonal cells. As you can see in this picture, this image is a specular microscopy picture where you can see all the cells are hexagonal. Yes. So again, you can measure hexagonality on specular microscopy. So what is a normal hexagonality? 70 to 80% is the number of hexagonal cells. That is, if you're counting 100 cells or you're seeing 100 cells, 70 to 80 of them would be hexagonal in a normal cornea. Okay, so this is in a normal cornea. Now, why should you know about hexagonality? Because hexagonality tells us what is the state of the endothelial healing So if at all there's some damage to the endothelial layer, there can be some disturbance in this hexagonal shape. So hexagonality gives an idea about how well the endothelial wound healing is happening. All right. What is CV? CV is coefficient of variation of the mean cell area. You all know, no? In mathematics, statistics, we've all learned about CV, coefficient of variation. So it's the same thing. So coefficient of variation of the mean cell area. So the area of the endothelial cell. So what is this CV value? So that is what we need to know. Let's not go into how to calculate and all that. So that's not a business, because usually it's the software that gives us the value. So we should know what is the normal value. So the normal value is 0.25, or in other words, it's 25%, because certain times they can give it to you as 0.25, or sometimes what happens is they give it as a percentage value. So in percentage value, it's 25%. So that's normal. Now, why is the CV important for us? So CV is the most sensitive index of endothelial cell dysfunction. Okay. Now, you know, indirect way of endothelial cell dysfunction is measuring corneal thickness, because if the endothelial cell is not working, obviously there's going to be edema of the cornea, because the endothelial pump is not functioning. That's an indirect way. But something direct and very, very sensitive, extremely sensitive, is this coefficient of variation. Okay. Question number 3, the given image depicts dash method of ECD measurement, that is endothelial cell density measurement. So endothelial cell density is the number of cells per square millimeter. Okay, so that is your endothelial cell density. So when we visualize on the specular microscope, we use a software to define a particular area or count, or in a certain way count the number of cells. So that is what they're asking. So the picture given to us is this. So here the software already has a fixed frame, okay, a fixed area, and within that area how many cells are present. So this is a fixed frame. Okay, so the presence of complete cells. Okay, so I've got complete cells, so I'm going to count the number of cells within this particular frame. Okay, so this is a fixed frame methodology. Now, what is a single field variable frame, multiple field variable frame, and there's nothing called single field frame variable field? Okay, so there isn't anything like that. So what is this variable frame? So basically we have two methods. One is fixed frame and the other is variable frame. And under variable frame you can have just a single field, or we can have multiple fields. So take a look at this one. So here, using the software, but manually we are outlining complete cells. So I can choose to have different frames, right? So maybe I can choose something here. So variable frame. So I don't have that single, one frame where depending on what is the size of the cell, accordingly the number of cells would come in there. So this would have been a fixed frame. Okay, whereas this is a variable frame. Now what is this single field and multiple field? Now if I just go ahead checking only one field, okay, so I check only one field, so I use a bigger area and I mark it. Now suppose I can do this, or maybe to get this area I'm going to use small frames but multiple areas. Do you understand? So let's say for example, this is 1 square millimeter. Let's say for example, okay, because I'm not that great with numbers. So to get a 1 square millimeter, I can use one single frame, or I can use a 0.5 square millimeter, a 0.5 square millimeter, so that eventually I get 1 square millimeter area to measure, to calculate the endothelial cell density. Do you get that? So we have in variable frame, you have single field or multiple field. So the answer to this question is fixed frame, because a given image shows the fixed frame method of endothelial cell density measurement. Question number 4, identify the marked finding. I hope by now you all know that this is a picture of specular microscopy. Now what is this dark spot? So this dark spot is a projection from the endothelium. So that is an endothelial excrescence. Okay, it's a projection because the endothelium is abnormal and it is laying down some abnormal collagen, right? Now this endothelial excrescence, if it is present in the peripheral cornea, it can be present in the peripheral cornea, which is kind of a physiological change that you see with aging in old corneas, where it's called Husson-Henle warts. Now, if it is present in the central cornea, it's definitely pathological, and this is also called peripheral corneal guttae, but when you use the word gutta, it is a central corneal endothelial excrescence characteristically seen in Fuchs endothelial dystrophy. Okay, so the hallmark of Fuchs endothelial dystrophy is a central corneal guttata, right? So this is gutta. Now, why is it not bulla? Bulla you get to see in the epithelial layer of cornea. You can see it in Fuchs, you can see it in other cases as well. So epithelial bullae, about epithelial bullae, what you need to know is they are very, very painful conditions. So whenever epithelial bullae is present, we call it as bullous keratopathy. Now, what is the most common cause of bullous keratopathy? The most common cause is a cataract surgery, following cataract surgery. So what we call as, earlier it was aphakic bullous keratopathy, now it's pseudophakic bullous keratopathy. You can also see it when there is a silicone oil in the eye. So after a vitreoretinal surgery, after vitrectomy, if we have used silicone oil as a vitreous substitute, yes, that can also cause bullous keratopathy. And just now what I told you, Fuchs endothelial dystrophy. So if you do not have this in your notes, now take down your notebook, take down cornea, and please add this stuff there, because if you're watching, you might remember for now, you might forget it later, so you better make a note of it. Okay, so this is about the bullae. So bulla is seen in epithelial layer. So this is gutta. Pleomorphism. What is pleomorphism? There is difference in the size, difference in the shape of the endothelial cells. So normally I said they are hexagonal in shape. So now they will be different shapes. So the answer to question number 4 is gutta. Question number 5. The given specular microscopy image shows. Now question number 5. The given specular microscopy image shows normal endothelium, guttata, polymegathism, endothelial bleb. Now, one thing for sure you know is it is not Gateta, because we have seen the image in one of the questions. So you know for sure that it is not Gateta. Okay. And you've also seen me explaining a normal endothelium. Okay, so this is normal endothelium. I discussed this with another question. So now let's take a look at the image that I've actually given in question number 5. So here you can see that there are some cells that are really huge, some cells that are small, and some that are, pentagonal, some hexagonal, a few hexagonal, but majorly I see a lot of huge cells. Yes. Now, one is I see polymegathism, huge cells, and I also see certain amount of pleomorphism. Now let's see what is there in my option. In my option, normal endothelium. No, this is definitely not normal endothelium. Gateta, no way. You know Gateta is going to have that blackish appearance, right? It's going to appear dark. Polymegathism, yes. D, endothelial bleb, no. Okay, so the answer here is polymegathism. So question number 5, some of you had answered normal endothelium because probably you didn't have an idea of how normal endothelium looks like. So now when you compare this image with the given image, you would be able to appreciate the polymegathism and also some amount of pleomorphism here. See, you can see square cells here. You can see clearly the pentagons. Yes. So there is also pleomorphism here in this image. Questions were useful for you, and what are the other things that you were expected to know? Okay, endothelial cell density, I hope you all know. Newborn, it's 4,000 and anything more than 4,000, guys. So don't be so finicky about that number. At least 4,000, okay? So newborn, because different books give actually different numbers. So 4,000 cells per square millimeter or anything more than that, okay? Then in a young adult, it's 3,500 cells per square millimeter. This is actually given in standard textbooks properly, okay? So 3,500. And the next number that you're expected to know is, go this order, okay? 4,000, 3,500. And what's the difference? 500. So remember this 500 as a critical density. Now, what is critical density? The density below which the cornea cannot sustain itself in a clear form. That means there's definitely going to be edema. So we do not have sufficient endothelial cells, therefore insufficient endothelial pumps. So the stromal edema occurs. So this occurs below a density of 500 cells per square millimeter. Okay. So this is something that you need to know about the ECDs, the endothelial cell densities. Then coefficient of variation, I've already told you. The normal is 0.25. Then polymegathism. Now polymegathism normal is 70 to 80%. All right. In a normal cornea. Now what are the causes of polymegathism? Causes of polymegathism, one is as always, diabetes mellitus. Anything and everything, we always say diabetes mellitus. So diabetes mellitus, and especially with increasing duration of a person being diabetic, the probability that his endothelial count will be lesser and there'll be polymegathism is high. Okay, so the chances of polymegathism is very high. And 2 surgeries, remember. One is cataract surgery, because during cataract surgery, there's a lot of endothelial cell loss. And to compensate for the lost endothelium, the existing endothelium will enlarge. That is why you have polymegathism. And corneal transplantation. So that is the other surgery, okay, post keratoplasty. And especially the lamella posterior type keratoplasties, okay, posterior lamella keratoplasties. Then contact lens use, long time chronic contact lens use, and for some odd reason keratoconus. So I told you 5 causes of polymegathism. So please add it in your notes. All right, you never know. With your INICET, a lot of new questions can come, and with a lot of clinical type of questions, this is absolutely important so that you know about the various causes of polymegathism. Okay, now the combination of polymegathism and that is the CV and hexagonality, where is it important? Now when we're doing a corneal transplant, okay, I want a certain criteria in my donor cornea. During keratoplasty, the donor cornea, we examine under specular microscope to look for endothelial cell density, the hexagonality, and also the CV. Okay, so endothelial cell density more than 2000 cells per square millimeter, so that the graft is viable in the recipient. Number 2, when we're talking about hexagonality, more than 50% of the cells, we want them to be hexagonal shaped. Number 3, when we come talk about the CV, the coefficient of variation of the mean cell area, it has to be lesser than 0.3, or in other words, it has to be lesser than 30%. All right, so these are the criteria that have to be met in a donor cornea before transplantation. Okay, so everything that you read is very, very important, very, very clinically relevant. Okay, so don't think specular microscopy is like something out of the blue. No, it's done routinely in clinical practice. Okay, so you expected to know all these extra points. I hope you're finding the OTAD session useful. Thank you guys. God bless you all.